world aren't trained this way, it seems like a strange message to them. Very strange. And it's hard for us as physicians to really appreciate this. But let's examine carefully the medical literature. In the Western world, in the United States and in Europe, there's been a shift away from the use of natural botanical medicines to the synthetic drugs, especially during the last 20th century. There was a reason for that. Cited reasons, well, we can have better standardization. We can have enhanced potency, ease of administration, widespread availability. And then, of course, there's the economic interest, the lobbying interest in Washington that are pushing for their drug medications. Has this resulted in the blessing that we had hoped for? In 1994, I think we mentioned this, and I'm just going to review this, and then I'm going to get up to remember I gave some statistics, and I told you I was going to take you up to 2008 or 9. Back in 1994, you remember over 2 million hospitalized patients had serious adverse drug effects, and 106,000 of these lost their lives. This made adverse drug events reported by the Journal of American Medical Association 1998 as causing somewhere between the 4th and 6th leading cause of death in the United States. It was reported as between the 4th and the 6th leading cause of death. That was the mid-90s. And you remember that didn't include adverse drug effects that were occurring outside of the hospital, from patients taking prescription medicines from the doctor's office, from the clinics, over-the-counter drug medication. I reported to you that article in U.S. Today, December 1998, that in 1997, the earlier year, just from one class of drugs, over-the-counter, NSAIDs, non-steroidal anti-inflammatory drugs, that over 16,500 Americans died from gastrointestinal hemorrhages in that 1 year, from over-the-counter medication. Is our government silent about these things? No, they are speaking. What do the health agencies say? This is from the U.S. Department of Health and Human Services, Agency for Healthcare Research and Quality, 1999. Adverse drug events occurring in hospitalized patients in the United States result in more than 770,000 injuries and deaths each year, and cost per capita, every hospital in this country, $5.6 million just to take care of the adverse drug effects. This estimate of cost does not include adverse drug effects that caused admissions to the hospital. Malpractice and litigation cost are cost of injuries to the patients. National hospital expenses to treat patients who suffer from adverse drug effects during hospitalizations are estimated to be up to $5.6 billion annually. And that's just in the hospitals. Now that is given in the best picture, where you've got doctors prescribing, nurses giving, and observing patients. And this isn't just mistakes and mishaps. These are side effects of medications. Okay? That was in 1999. I'm going to jump to 2005. This is from the Research on Adverse Drug Events and Reports Project. It's called RADAR. reported that adverse drug and device reactions are accounting for as many as 100,000 deaths annually here in the United States. And that's just from what is reported. Okay, and I'll get into that in just a minute in terms of what is the estimated reporting rate of adverse drug effects. In general, more than half of the most serious adverse drug reactions were discovered 7 or more years after the drug was marketed. Okay? In other words, when you think, well, it's gone through trials and all of that, so it's safe. No. More than half of the most serious drug reactions were reported 7 or more years after the drug had been on the market, released. That was from the American Medical Association Journal, May 4, 2005. 2006, what about antibiotics? No problems, right? There was an article written in The Consultant magazine, it's for physicians, volume 46, number 10, September 1, 2006. And the article was called, "What Hath Antibiotics Wrought?" The answer, the nightmare of Clostridium difficile colitis. Dr. Gregory Rutecki, professor of medicine at Ohio State University in Columbus, stated in this article in Consultant that with the ever-increasing use of broad-spectrum antibiotics here in the United States, there has been an equally escalating appearance of severe bacterial colitis, Clostridium difficile, which may result in either total colectomies for patients, they have to take the whole colon, or sepsis, bacteria invading the bloodstream, and death. Sounding the voice of alarm, Dr. Rutecki goes on to state that not only are the incidence, severity, and the expense of C. difficile infection on the rise, but the newer antibiotics used with ever-increasing frequency have created an even more resistant super strain of Clostridium difficile. And so when you're killing off all the other bacteria, and these strains are resistant to the antibiotic themselves, they're going to replicate and produce this toxic enterocolitis. At the time of the writing of Dr. Rutecki's article, the mean cost of treating this infection was about $10,970 per patient to treat this infection, because they have to hospitalize them usually. They're treated with vancomycin, which is a very expensive drug, all of the nursing care that's involved. Resultant healthcare costs for treating C. difficile was estimated to exceed in this country more than $1 billion a year, just from the side effects, one side effect of antibiotic use. And so his recommendation regarding the best course of action to take to reduce the incidence of this serious healthcare complication, antibiotic stewardship with restraint in the use of epidemiologically implicated antibiotics, usually the second and third generation, and these were the class of drugs. Second and third generation cephalosporins, those would be agents like we commonly see, cephalexin, Keflex, you know, some of these that are given so widely for routine infections, clindamycin, and the newer fluoroquinolones like ciprofloxacin, norfloxacin, you know, those agents. Let's go to the year 2007. This review was published in the Archives of Internal Medicine, 2007, and it reported a study period 1998 to 2005. The U.S. Food and Drug Administration has operated the adverse event reporting system since 1998. It collects all voluntary reports from adverse drug events submitted directly to the agency or through drug manufacturers. Now that's already a bias, isn't it? Okay. And it's estimated, I believe, that probably, what is it, about anywhere from 1 to 10% of the adverse reactions are being reported through those agencies, from 1 to 10%. That means about 90% are never reported. But of those that are reported, we're looking at those, okay? From 1998 through 2005, in that time period were reported serious adverse drug events that had increased 2.6-fold over that time period, and fatal adverse drug events had increased 2.7-fold from 5,519 individuals to 15,107 people from the beginning of that period to the end of that period. When it started reporting, what? About 5,000 people? To the end, 15,000 each year. So what does that tell us about the seriousness of the drugs that are being used? You're getting an ever-escalating death rate, okay, from these drugs. Reported serious events increased 4 times faster than the growth in the total number of outpatient prescriptions written. Now that's interesting if you think about it. The drug events themselves increasing 4 times faster than the number of prescriptions that were being written. Think about that. These data show a marked increase in reported deaths and serious injuries associated with drug therapy over the study period. The results highlight the importance of this public health problem and illustrate the need for improved systems to manage the risk of prescription drugs. Now, the conclusions of this article were very interesting. Not all adverse reactions to new drugs can be anticipated or avoided under the present system, according to medical experts. It's just not possible for us to know ahead of time. Secondly, it's simply not possible to identify all the adverse effects before they're marketed. And thirdly, over 51% of the approved drugs had serious side effects not detected prior to their release. Over half. Now this is from the Archives of Internal Medicine. Use of painkillers, 2007. I'm just going to show you a picture, okay? Can you see this bar graph? What's happening on the bars? They're increasing. This is from the year 1991 to the year 2007. And this is the reported incidence of fatalities from the use of narcotic medications. Okay? Pardon me? That's what they know about. That's correct. That's what they know about. Now I want to go to 2008. That was last year, right? 2008. This data was released from the Institute for Safe Medicine Practices during the first quarter of 2008. That's the first 3 months. there were 20,745 adverse